Hello everybody. I thought it would be a great idea to go over some of the really important exercises that I like to tell my patients. And really I want to focus on something that is an epidemic in our country right now, which is called tech neck. I'm sure you've all heard of it. It's actually been around for years and years and years with us studying and being on computers for so long. But now with the advent and incredible amount of usage with cell phones, we find ourselves in this posture so often. There's another element of it called digital dementia, where when you have your head fixed at one position for so long, it actually only has one part of the brain concentrate. It's really a problem with our children. Kids that are playing with these machines and only having their brain focus on one point as they're developing are developing all kinds of other disabilities, and it's really important that you're paying attention to that and getting them out and having them do things. So I want to talk about some of the exercises that are key. This chart up here shows what happens with every 10 degrees of flexion. You're putting more and more weight on the base of the neck here, which is affecting the spinal cord, all of the nerves that go into your hands, shoulders, wrist, elbows. Also the blood vessel that goes up through the neck is going to be choked off when you do that. So if this is a spine and it's supposed to have a curve like this, and you're bending it forward like that, if I were to take a 10-pound weight and hold it like this, or like this, or like this, it's putting so much more pressure on my arm, it's going to start to affect the neck muscles, eventually cause those discs to wear out. When you have the spinal vertebra and the discs, the nerves come down through the back of the spine and exit at every level. But when you have constant grinding and pressure on those discs, what we see eventually is we see the bones start to wear out and decay, kind of like a tooth. And the discs dry up and become brittle, and then you start to get, if this is a nerve, pressure wherever those nerves go, whether it's to the thyroid gland, the muscles of the neck, up into your head. People can get headaches, eye strain, even anxiety and stuff because of the pressure going up into the brain area, let alone all of the problems down the arms, shoulders, hands, even some problems in the heart and lungs because those nerves go to that area. So there's one of the key things that I want to go over is what to do about reversing this. So if we're like this all day, these muscles are all tight and these muscles are turned off. As an example, if I were to lift a weight like this, these muscles have to relax. If they were tight, I wouldn't be able to lift the weight. So what we're going to have you do, and if this hurts, don't do it and come see me or somebody, but roll your shoulders back and then your head back and hold it like you're squeezing a lemon between your shoulder blades. And you want to do this with a pretty good amount of effort. So what I'm doing is I'm tightening up the muscles in the back called the extensor muscles and relaxing all of these. It feels really amazing. So I recommend you try that. Do it for about 10 seconds and do it several times a day. Again, if you get dizzy or if it hurts, don't do it and come see me or somebody else who can help you with it. The second exercise I want to talk about is how to help your posture. And another one of the things that cause those dowager's humps or the leaning over posture that we see with people as they age or as they're sitting in poor position all the time. So what I want to work on is each individual set of muscles that move each individual set of bones. You have 24 bones, and as you go like this and you have injuries, the muscles atrophy and no longer work. So what will happen is the disc will start to wear out. As the chiropractor, as we go in and find specific segments that aren't working well from an old injury and we start to get motion in there, next we need you to start to exercise those muscles. So I'm going to sit down here and show you how this works. Now it's a very easy exercise, and what I'm going to be doing is concentrating on moving these bones up and down. So you start with your hands here and have them just rub across your legs. Now this seems kind of silly, but it's actually moving the very bottom vertebra on my back. Now as I'm doing this, I want a straight posture, my chest out. I could even start with this to make sure I'm in the right posture and go like that. Slowly work up my spine. It's going to take me about 45 seconds to do this exercise. So I think everybody's got 45 seconds, I hope. If not, come see me. So get up between your shoulders here, and then you're going to feel it as you move your arms. You're going to notice that that is actually where it's putting the most emphasis on the spine. So as you do this, we're using these little teeny muscles that move one bone to the next. Anytime you use a muscle, it's going to get bigger, it's going to get a better blood supply, and it's going to be stronger, obviously. So we want your spine to be as strong and resilient as possible. And as you're doing this exercise, usually within a few weeks, what patients tell me is that they feel heat running up the back because those muscles have gotten so large. The blood supply increases. Just like if you go to the gym and you see a guy that came in like this and he left like that. He has those big old blood vessels now where he hadn't them before. The body works on supply and demand. So those are your two exercises I want you to concentrate. Again, doing this one. The second one is the rotation. Do it once a day and I'd be happy. Also, if anybody has any pains or any injuries that they just don't feel like they're in the shape they need to be in, then definitely give us a call. Our number is 459-9990, and we will offer you a complimentary consultation and exam just by mentioning this video. So send this out to the people you know, your friends, your family. Let's see what we can do to get people healthy and happy. Thank you. Have a great day.